Hello everyone. Our today's topic is venous thromboembolism, VTE in short. It is a condition in which a blood clot forms most often in the deep veins of leg, groin or arm. It is also known as deep vein thrombosis, DVT, and travels in the circulation, lodging in the lungs, known as pulmonary embolism, PE in short. The risk factors of VTE include major general surgery, major orthopedic surgery, lower extremity paralysis due to the spinal cord injury, fracture of the pelvis, hip or long bones, multiple trauma, cancer. All cancers increase the risk, especially if the cancer has spread widely and if it is a cancer of lung, brain, lymphoma, gynecologic system like ovary or uterus, or gastrointestinal tract like pancreas or stomach. In patients with cancer, chemotherapy and surgery for cancer further increase the risk. Additional factors. Individually, the factors below are not enough to justify preventive measures for venous thromboembolism, but a combination of two or more may be cause for action and could influence the type and duration of the prevention treatment. Prior VTE. Patients with a previous episode of VTE have a high chance of recurrence. Age. Patients older than 40 years are at high risk, and that risk doubles with each subsequent decade. Obesity. People with obesity have two times the risk of VTE as people with normal weight, and the higher the weight, the higher the risk. Immobility. Prolonged immobility, such as during long travel, combined with other major risk factors, increases the likelihood of VTE. Oral contraceptives or estrogen. Treatment for menopause symptoms. Family history of VTE, especially if this is in a first degree relative, parent, sibling, then child. Physical inactivity. These are some of the additional factors. Do you know what are the warning signs? DVT mainly affects the larger veins in the lower leg and thigh, almost always on one side of the body at a time. The clot can block blood flow and cause leg pain or tenderness of thigh or calf. Leg swelling is also known as edema. Skin that feels warm to touch, reddish discoloration or red streaks. Pulmonary embolism can be fatal and occurs when the DVT breaks free from a vein wall and blocks some or all the body supply to lungs, causing unexplained shortness of breath, rapid breathing, chest pain anywhere under the rib cage, may be worse with deeper breathing, fast heart rate, lightheadedness, or passing out. How is it diagnosed? Blood work may be done initially, including a test called D-dimer, which detects clotting activity. For DVT, ultrasound of the leg is most often used. For PE, computed tomography, or also known as CT scan or CAT scan, is most often used. Sometimes ventilation perfusion lung scan is used. Both tests are able to see intravenous dyes in the artery of lung, looking for blockages by clots. Lifestyle changes. Quit smoking. Lower your blood pressure with dietary changes, like reducing your salt and sugar intake. Lose weight if you are overweight. Avoid sitting for long periods of time. Get up and walk around. Every so often, if you are driving or on a long flight, flex your feet to stretch out your calves. Exercise regularly with some activities such as walking or swimming every day. Don't wear tight clothing when traveling long distances. Wear graduated compression stockings, especially after a surgery or if you are on bed rest. Increase intake of fluids. Drink a lot of fluids. Stop taking birth pills. Treatment. Once a DVT blood clot is diagnosed, your doctor will likely prescribe a medication to help thin the blood or break up the clot. You can even combine the prescribed medication with the following home remedies to prevent other complications and reduce the risk of future blood clots. Example: aspirin, clopidogrel, heparin, warfarin. You may have to take anticoagulant medication for 3 to 6 months, sometimes longer. Make sure to follow your doctor instructions carefully. Taking too much of anticoagulant medication like warfarin can thin the blood too much and lead to bleeding problems. Prevent injuries or falls, which include avoiding contact sports, wearing protective gear like helmet, or using a walker or cane. Inform your doctors about any other medication, supplements, and vitamins you're taking. Visit your doctor for regular partial thromboplastin time tests, which is also known as PTT, to make sure you're receiving the right dose of anticoagulant if your doctor tells you to do so. Avoid changing or stopping your medication unless your doctor tells you to. Take your medication at the same time each day. Call your doctor if you miss a dose. Make sure all the doctors and dentists know you are on anticoagulants. Note: if you have been prescribed anticoagulant medications, don't take aspirin and medicines that contain aspirin. Avoid other non-steroidal anti-inflammatory drugs as well. These include ibuprofen, Avil, Motrin, and naproxen, a leaf. Thank you.